Swastiastu. Good morning, Doctor and friends. We are from SGD B3, the 7th semester of Bachelor of Medicine, Udayana University. Today, we would like to present our student project, which titled HIV Self-Testing for Men Who Have Sex with Men, an implementation trial in Indonesia. First of all, here are the members of SGD B3. My name is David Christopher Chandra with the student number 066. And now, I would like to start the presentation with the introduction part. HIV is a virus that attacks human immune system and can lead to AIDS. It spreads through the infected person's body fluid. In 2023, around 39.9 million people worldwide were living with HIV. In 2020, Indonesia has 540,000 people living with HIV. Groups of people who are at high risk of this disease are women with high risk partners, people who inject drugs, sex workers, and men who have sex with men or MSM. HIV prevalence among MSM is 11 times higher than the general population. HIV testing in Indonesia is typically done at healthcare facilities, which often cause anxiety due to the stigma and discrimination. One solution to this issue is using the oral fluid testing or OFT, which involves using a saliva sample known as oral fluid to detect HIV antibodies. This method is non-invasive and the process is straightforward and can be done privately. The person simply swipes the test device inside their mouth and results are available quickly. Here are our student project's problem formulations, which focuses on identifying HIV determinants, its link to occupational diseases, evaluating study designs, recognizing biases, and assessing screening methods, with the goal of contributing to HIV prevention and also control in the community. The objectives of the student project is in line with the problem formulation that we made before. The benefits of this student project is to improve the public understanding of HIV transmission factors and optimize resources for prevention and treatment programs through the targeted education.
Let me introduce myself. My name is Agung Librawan Darmalaksana with relationship of student number R029. We continue by discussing chapter 2 literature review. I want to explain about the determinants of HIV. Disease determinants are various factors that affect the health sector at the population level, which are useful for identifying the causes, patterns, and methods of disease prevention and control in population. In this journal, we use the epidemiological triad model on the basis that if these three things are not balanced, then a disease can occur in a population. When the host, the key population, experience conditions that disrupt socioeconomic inequalities, including climate change conditions that encourage this condition, there is an increase in transactional sex without adequate health facilities. In the end, there will be a high risk of HIV spread and less interest in participating in the HATI program. And that's all from me. The next will be explained by my friend. Thank you.
My name is Rania Parawita with last 3 digits student number is 1026. So today I will explain about natural history of HIV. So basically HIV infection goes through main two stages, acute and chronic. For acute phase, HIV mainly attacks CD4 lymphocytes, especially those with the CCR5 receptors. This phase often includes symptoms like rash, fever, and swollen lymph nodes, along with high viral loads and strong immune response. So for chronic phase. After the acute phase, HIV enters a chronic stage where it spreads to other immune cells and organs. So basically, HIV can be treated by antiretroviral therapy or ART by lowering viral loads and increasing CD4 counts. If untreated, HIV usually progresses to AIDS in about 10 years. However, ART can be slow or stop this progression. Early diagnosis and starting ART promptly are crucial for preventing the progression to AIDS and reducing the spread of HIV.
My name is Yosephine with the last 3 digits of ID number is 094. HIV as occupational related disease. HIV transmitted through sexual contact, pregnancy, and childbirth, and reuse of medical equipment or syringes. HIV is also transmitted through body fluid such as blood, amniotic fluid, breast milk, semen, vaginal fluid, pre-ejaculated fluid, and rectal fluid. Although the mode of HIV transmission are well documented, occupational exposure factor may also influence the prevalence of HIV infection. Occupational exposure to the HIV is a frequent concern among health workers. Healthcare workers has increased risk after an occupational injury or exposure to body fluid, blood, body tissue and contaminated surface. This is also due to poor maintenance of safety practice, lack of basic personal protective equipment, and poor management of sharp waste in health facilities. Other fields such as the entertainment industry also have the potential to face occupational exposure, especially for sex workers. Sex workers are usually found in places where prostitution can occur, such as clubs, spa, and others. This is related to the absence of condom use in sexual behavior. In addition, drug use as a psychological driver in their sexual behavior also positively correlated with HIV infection, according to the way HIV is transmitted in the use of injection needles. That's all from me. Thank you.
So hi everyone, my name is Khadra from Kamila with last digit number 009. I would like to explain about the numbers and interpretations of the journal articles. So the journal articles use different types of number to present data and the finding of the research, and each interprets the data in various ways. The use of absolute numbers in these articles is to provide a clear idea of the size of the populations under study. Some examples, namely the total number of the participants who carried out the OFT between January and December 2018, which are 813 participants, while percentage in this article used to compare the size of a subset to the whole group of the population under study. Some example is the percentage of participants that chose supervised testing, which is 93%, which means 765 out of the 813 people. It also used proportional ratios in presenting the research data. For some example is a comparison between the increase of HIV testing rates before and during the intervention using OFT, which represented by an increase of 52%. So that's all from me, and the next will be explained by my colleague. Thank you.
Hello, my name is 𝗛𝗏𝗪 𝗪𝗏𝗪𝗃 with my study number is 130. Now I want to explain about 2.5 research design and method. The research employs a quasi-experimental design with pre-test and post-test approach conducted in cities with significant sex men populations. The target population includes men aged 18 years old and older who identify as sex men. The total sample is around 200 respondents. For the inclusion criteria consists of men who are willing to provide consent to participate in the study, while for exclusion criteria include men who have already been diagnosed with HIV and are receiving antiretroviral treatment. For data collection will occur in 3 phases. Phase 1 is preparation, Phase 2 implementation, and Phase 3 evaluation tests. For the instruments used in this study includes a demographic questionnaire, HIV knowledge questionnaire, satisfaction and acceptance questionnaire, and the last one is qualitative interview. For the quantitative data will be analyzed using statistical software such as SPSS, while qualitative data from in-depth interviews will be analyzed using a thematic analysis approach. So that's all from me. Thank you.
Hello everyone, my name is Fricillia Wijaya with the last digit name is 236, and I will explain 2.6 data analysis and presentations. So from the data analysis and presentations used in this journal article are generally appropriate. It is because of specifically it is used by independent t-test to compare mean testing rates and chi-square tests to examine differences in characteristic among MSM, or can also be called as men who have sex with men, both of which are suitable for the data being analyzed. The significance level is set at 0.05, which is standard in medical and public health research. So overall, for the data analysis and presentation used in the journal article are generally appropriate. Maybe that's all from me. The next one will be explained by my friend. Thank you.
My name is Putu Krishna Arsawardani Putri with last digit number 027, and I will present about the source of bias in this study. Bias in academic research is a form of systematic error that may lead to a distortion in measurement and influence the outcomes of an investigation. This study presents several potential biases that may affect the validity of its findings. Selection bias is a notable concern. Participants in this study were recruited from gay bars, spas, and apartments. While these venues are frequented by men who have sex with men, the individuals who visit them may not reflect the entire MSM population in Bali. Another significant issue is follow-up bias. 11 out of 39 participants who started ARV therapy were lost to follow-up, creating uncertainty about whether their outcomes differ from those who remained, potentially affecting measures of ARV effectiveness and viral suppression. Self-reporting bias is also a concern. In unsupervised groups, some participants did not report their HIV test result, possibly leading to underreporting, skewing the positivity rate. Self-reporting may also lead to false reading due to lack of experience. Lastly, ascertainment or verification bias occurs when not all participants with a positive test result undergo further confirmation. Only 63% of participants with a reactive OFT saw confirmatory testing, suggesting the true positivity rate may be higher than reported.
Hello, my name is 𝗂𝗏𝗪𝗂𝗃𝗏 with my last two-digit number is 165. And now I will continue the presentation about the potential outbreak detection. So for gay men, especially men who have sex with men, face a disproportionately high risk of HIV due to biological and behavioral factors, such as unprotected anal intercourse, which enhance virus transmission. With the higher prevalence of HIV within the MSM community, increase the likelihood of further transmission during sexual intercourse. Social stigmatization exacerbates the issue, as discrimination and internalized homophobia can lead to risky behaviors like avoiding healthcare or engaging in protected sex. In the US, MSM make up the majority of new HIV infections, particularly among younger generations, despite being a small percentage of the population. While pre-exposure prophylaxis has helped curb infection rates, access to this preventive measure is uneven, especially in rural and underserved communities. Cultural and psychological barriers, including fear of judgment, and the normalization of casual sex to digital platforms further contribute to the high risk of sexual behaviors. To prevent further outbreaks, a comprehensive strategy is essential, encompassing improved access to PrEP and public health campaigns to reduce stigma, widespread education, and integrated mental health support. That's all for me. Thank you, and my friend will continue the presentation.
HIV surveillance system. To understand and control the spread of transmission of HIV, a sustainable HIV surveillance system is needed. A good surveillance system is expected to collect, analyze, and interpret data on HIV infection, which will be followed up by making public health policies and expected to reduce transmission and improve nation's health. The development of communication technology today can be a very beneficial tool in this regard. Mobile health application or integrated website can have proven to be very helpful in the data collection process. In addition, many countries have already using electronic health records with integrated data, collecting HIV prevalence and incidence become real-time and accurate. For example, the CDC's implementation of the Enhanced Comprehensive HIV Prevention Planning or 𝗂𝗏𝗃 program from 2019 has utilized geospatial mapping and data visualization tool to identify high-risk areas and population. This mapping will later be utilized for more targeted intervention and prevention. For some of the test strategy of 𝗂𝗏𝗃 program are routine HIV testing in both clinical setting and non-clinical setting, linkage and promote to care and social services, promoting antiretroviral medication, behavioral risk screening, STD screening, prevention to perinatal transmission, condom distribution, and provision to post-export prophylaxis. Besides the 𝗂𝗏𝗃, another federated body can be supported the HIV surveillance system is the Health Resources and Service Administration or HRSA Ryan-wide HIV and AIDS program. This program emphasizes a community-based approach that is also considered effective. Community involvement in the HIV surveillance system help improve data accuracy and also foster trust amongst the population. The initiative uses peer navigator to collect data and engage community members, resulting in higher response rates and more representative data.
Hello teachers and friends, my name is Anastacia and Tanberius and my last three-digit numbers are 154. Here I'm going to explain HIV screening among men who have sex with men or MSM. There are a few types of HIV testing such as rapid test, laboratory-based test, or self-testing kit. The most usually used HIV testings is antibody test, antibody antigen test, or nucleic acid test. In recent trends, there are high-risk populations of HIV called MSM or men who have sex with men. They can done HIV testing by HIV self-testing or 𝗂𝗏𝗪 done by collecting their own sample, rapid testing, and interpreting their own result. Oral fluid test is also another choice for 𝗂𝗏𝗪, which can help barrier for people with HIV.
Thank you for the opportunity. My name is Wilbert Purnamsidi with student number is 135, and now I will explain about 2.11 relevance to control and prevention effort in community. So based on the article, the study on OFT among MSM in Bali is highly relevant to disease prevention and control effort in community. By demonstrating a 93% preference for supervised OFT over traditional facility-based testing, the findings highlight the effectiveness of community-based approach in reaching underserved population. With a reactive result of 10%, OFT effectively identifies individuals who may avoid healthcare services due to the stigma. Maybe that's all from me. I give it to my friend. Thank you.
Next is Chapter 3, Conclusion. Hello, my name is Nibbana Siva with real digital study number is 070. Now I will present a summary and a recommendation. HIV transmission is influenced by a mixed factors related to the host, the virus, and the environment. Climate change exacerbates HIV spreads by increasing vulnerabilities, drug migration, food scarcity, and economic disruptions. HIV progresses from an acute stage with high viral loads and immune response to a chronic stage where the virus spreads and the immune system adapts. For occupational risks, especially among healthcare and sex workers, safety protocols and protective equipment are crucial. Effective data analysis helps understand HIV trends and outcomes. MSM, or men who have sex with men, are at high risk for HIV outbreaks due to biological, social, and physiological factors. Comprehensive prevention strategies, including better access to PrEP, education, stigma reduction, and mental health support, are needed to prevent future outbreaks. A strong HIV surveillance system is vital for understanding and controlling the spread of HIV. Supervised oral fluid testing, or OFT, is highly preferred and effective in identifying individuals who might avoid healthcare due to stigma. For recommendation, HIV is a serious health issue, especially for high-risk groups like men who have sex with men or MSM. To manage and prevent HIV effectively, we need to provide comprehensive education to improve knowledge about sexual health and reduce stigma through public health campaigns. These efforts can help improve health outcomes and reduce HIV transmission within the community. So that's all from us, SGD B3. Thank you.
That's all from us from SGD B3 for today's presentation. We are sorry if there are some mistakes during our presentation. Lastly, we want to close it with the Paramasanti Om Santi Santi Santi. Thank you so much.